California now locking down as of yesterday certain areas there. Can you just give us a perspective, really, of what's going on the ground? How bad is it?
It's not good. It's we're having more cases than we've ever had. The ICUs are starting to fill up in the lower San Joaquin Valley between Fresno and Bakersfield. Los Angeles, the whole metropolitan Southern California area, their ICU capacity has fallen below 15%. It's very, very problematic, and it's approaching the scary.
Is 15% the right number? Is that the correct way of approaching this problem? You get below that level of capacity, spare capacity, and you shut everything down?
I think you could put it higher. Arguably, it shouldn't be lower though. But you have to have some number, right? What we're trying to guess is where we're going to have to slow everything down so much. As Macron said, the brutal break, right? We have to pull the emergency brake at some point in time, and I think 15% is as reasonable a metric as anything. You don't want it lower. You could have it a little higher, but you might be pulling it early. So I think this is just about right.
Doctor, what's interesting is how the markets are just looking through it, and part of it's the vaccine. Some people are also saying that markets are looking through this because the lockdowns aren't as severe as they were the first time. Businesses have learned to manage things. I guess my question is, can we stay not as severe in terms of the lockdown in March?
Yeah, well, we know things now that we don't know and didn't know in March. We know a lot more now. For instance, schools are allowed to remain open during the lockdowns. Retailers are able to continue to have on-site sales, but with a diminished density of shoppers in the stores. So all that's going to work. I think, I'm glad I don't own a bar. Unfortunately, those who do, it's just not a good time. But the restaurants are going to continue to have takeout, which is not great, but it's certainly better than nothing. But certain parts of the economy, theaters, movie theaters, for instance, though they're just, that's just not going to happen. We can't allow that part to happen. So it's somewhat more selective than early on in the year, and it's more targeted, but it's going to feel like a hammer nonetheless.
Professor, Thanksgiving was a couple of weeks back. Are we feeling that now? When do we fully feel Thanksgiving, and when does the peak come?
So we're feeling Thanksgiving right now. It was the New York Times had an interesting piece looking at the impact of Canadian Thanksgiving on transmission rates in Canada in mid-October. And they had an acceleration. We're seeing exactly the same acceleration, not only around the country, but here in California as well. When the peak comes, depends on how well we're able to lock down. I think if you look at some of the Western European countries, notably France, they were able to really turn the corner with their peaks and drop transmission rates to low levels with about 2 weeks of lockdown. So you have to understand there are people in the pipeline now who are infected, who've been exposed, are developing infection, are going to eventually get to hospitals and to ICU. So that's a 3-week pipeline. And we're trying to kind of manage out on the other end of that. But I think you have to give it a few weeks to see how it's working.
Doctor, are we going to have a Christmas?
Every who down in Whoville love Christmas a lot. Yeah, of course we'll have Christmas. It's just not going to be the same. So save your big holiday parties for next year, or just push them off into the spring and pretend it's Christmas then. I can't give you any better advice than that.
Can I just push back to where we started the conversation with Alex Azar talking about the availability of the vaccine for everybody by Q2? Is that the point at which we stop rationing? And do you think the model for rolling out the vaccine is the correct one in order to achieve the maximum effect?
Well, we're trying to solve two problems at once here in the initial rollout. And it doesn't matter if we have a zillion doses right now today. Somebody's going to have to get it first, and we're going to have to put the logistics in place for someone to get it first. So I don't think of it as rationing, but more kind of an intelligent rollout. We have to protect healthcare workers. We can't, this is the wrong time to have ICU and acute care hospital bed capacity decrease because healthcare workers are getting sick or they're getting exposed. We can't afford that. ICUs are far more than beds. They're people, right? And we have to have the people. So that's one thing. And the second thing is trying to protect the most vulnerable, those who are most vulnerable to death And, there's another spate now of nursing home outbreaks. And we would, we want to keep those people as protected as possible. Then we can start moving on out from there. But that's the most critical infrastructure, the ICU workers, and the most vulnerable people in nursing homes. So I completely agree with that. I think that's absolutely the right move.